Hey everyone, welcome to the Neurofucked podcast. I'm your host, Jackson Rosa. Over here we have the wonderful, lovely...
Aw, Haley Olivia.
Don't act surprised. You are lovely.
Okay, wow. Oh, you're being really nice to me right now. I don't know what to do.
It's all... You think I'm a schemer? You think I'm just saying nice things?
No. But anyways, welcome to our podcast. If you're new here, join us. Come in. Enjoy the vibes. Enjoy the information. We have a whole bunch of awesome guests coming on this season. Right, Jackson?
We do, and it's incredible. We got artists from all walks of life. We got wonderful people in entertainment and acting and the arts and music and design and animation and a psychiatrist. And you know what's great about that? We are fulfilling the mission of this podcast, one subscriber at a time. So, you should subscribe. And maybe send us a little donation, too.
Yeah, and if you are not new here, welcome back. We wrapped you in our clutches, and you're never leaving.
This is her manipulative side coming out, so... Oh, shit.
It's time for Neurofucked Podcast with your host, Jackson Rosa, that mischievous motherfucker. Haley Olivia, what's your name, girl? You on the spectrum? And Terrence. We've got autism, ADHD, OCD, all the D's. We got stories and artists from all walks of life. It's time to get fucked neurologically.
All right, everybody. So this is Dr. Mercedes Okosi, and she is a clinical psychologist from New York. So, Dr. Mercedes, would you like to give a little bit of your background and a little bit about yourself?
Yeah, thanks for having me, first of all. I'm honored to be the first psychologist guest.
Yay!
So as you said, I'm a clinical psychologist. I work in New York in a university and also in private practice. I have been practicing licensed now for the past 7 years, but I did a PsyD, which is a doctoral program that more heavily emphasizes clinical practice. So I've been seeing patients and treating people for over 10 years now. I specialize in trauma and PTSD, so a lot of people seek me out specifically for that, but I see a range of people, from people dealing with everyday stressors and life transitions to testing, to more severe and persistent mental health presentations. So I'm glad to be here. Yeah.
Awesome.
Wow.
Awesome. That's cool.
The resume you have.
You got quite the professional.
I'm listening to this and I'm like...
We're not worthy. No.
No.
I'm just joking.
We're all worthy in some way, but we don't have... We're not in that fields or anything. Like, Jackson has a great resume and everything, but like... We're all entertainment and everything, so we're hearing doctorate and all those things, and we're like...
Listen, I've worked with PhD students. Everyone's brilliant in our own special way.
Yeah.
Everyone's got their own little thing. So I have a question for you. When you got in, what was the kind of impetus that got you into these studies, and what did you? Okay, vocabulary. Well, I'm whipping out the thesaurus today. What was the reason you got into this field in the first place?
Yeah, I think to some extent you will find that most psychologists and other therapists and people across different careers have like parts of their personality that naturally draw them to their field or their passion. So I knew that I wanted to be a psychologist since I was in like middle school.
You started young, jeez. Wow.
Yeah. I'm a person who's like very introspective and curious about the world and people. And I wanted to use those like things that came naturally to me to also be able to help people and impact the world, especially a lot of populations who are have more difficulty or barriers with access to mental health. and seeing mental health as like a foundation for like your total well-being and life health. So I pretty much, went that route, and it's been fulfilling so far.
Amazing. With the idea that I know I'm just editing from over here. I need to stop looking at the screen. So I'm trying to give him some feedback, but so we're all this is fully produced by people on the spectrum, Terrence, Haley, and I included. Maybe at some point in the future this could be a project that could like bring some equity to people on the spectrum, or we get 501c, or we do some sort of thing where we can hire people on and actually make it a media project that is like worthy of that and some fundraising. So that's pretty cool. But I just want to say, what is from your personal experience? So you got into this, you were very interested in being a clinical psychologist from a young age. What is give us a little tale of your life in New York.
My private practice has been in New York the whole time. I do have one clinician working with me that's also licensed in New Jersey, but pretty much New York. I opened my practice in 2018, end of 2018.
Question 18.
And I think a lot of people, especially during the 2020 lockdown times, had to like sit at home, maybe recognize things or dealt with things about themselves and their families that they previously could distract themselves from. So I got a lot of people coming to therapy then. Since then it's been pretty busy and pretty consistent. Like I said, a lot of people come to me for trauma and PTSD work, but I do see a lot of people who have a range of different concerns, and some people who have already either been evaluated and diagnosed with different types of neurodivergence, or who are curious about that. Mainly New York.
What do you see more often with diagnoses or presentations of different mental illnesses? It doesn't have to particularly be like autism or ADHD or anything, but like, what do you see more of?
Yeah, I would say the most common things that come up, and I think even just like by numbers statistically, different depressive and anxiety disorders are more common. So, and that can range from like someone experiencing like a chronic general anxiety to just like an adjustment kind of period where they're dealing with a lot more anxiety and distress around a life transition. And also with some of the mood disorders. So you see people who have had like years of chronic or multiple episodes of depression across their lifetime. And sometimes people who are dealing with like different levels of mood dysregulation on a more regular basis. But mood and anxiety things are the most common, I would say.
And something
along with just like relationship distress too.
Yeah, and something I believe it was my junior year, I was diagnosed with generalized anxiety disorder, put on citrulline. I've been on the beta blocker for like all the way to now. And something I'm curious about is I didn't figure out that I was autistic until like 2 years ago. And so how does that... a lot of people seems to be diagnosed with anxiety and then find out later in life that they're autistic. And I don't know if you've had any findings in that or have had people come in for that or anything, or...
Yeah, definitely. There have been people who, for example, like in their 20s or like past childhood, start to get feedback from other friends who have already been tested and evaluated and know that they're on the spectrum. And so then that person's friends start telling them like, hey, have you ever considered, or, you know,
That's us.
Yeah. Her and her twin sister. I clocked it right away. I like to say that I like am the autism whisperer.
Yeah.
But no, I think that it's more. I think that it's more like that you just see these things. You have a sixth sense if you've lived with it, and you've lived with the knowledge that you've had it for long enough. You kind of start to attract those people into your life a little bit, but also you see the signs because it's not as obvious to everyone else. So
yeah,
and
and I think. Oh, sorry.
Oh yeah, go ahead.
I was going to say, I think even with professionals, like I guess I can only speak from my grad school experience, but knowing my peers now, we all learn about everything in the DSM. And in part of the DSM, there's like all of the developmental conditions and things that are listed there. So everyone learns about everything in terms of like a generalist approach. But it is the case that if you don't necessarily like specialize with a particular population, then some people may be diagnosed late because they may see people who aren't experts in that area, and so who are not considering that in their differential diagnosis or not doing testing unless they see something that's on the more obvious end of the spectrum. So it is easier to, especially because these things overlap and there are some features of certain conditions that you see in other presentations that like someone may be presenting with anxiety, but anxiety can happen as a response to many other internal things going on or environmental things going on or developmental things. So sometimes, people don't get the proper attention for a long time until either they notice or other people start noticing that it may be something to consider.
do you think that a lot of it gets misdiagnosed as like generalized anxiety, or like it's one of the things that I noticed when the way that I try to describe these disorders to people in a general way, like someone, the average population would be that it's like a base layer anxiety. It's not the type of anxiety that you get from external, even though maybe it is stimulated.
Yes.
But I would say that like it's anxiety built up, but it's coming from all different, layers, and as opposed to just being. So the way I describe it to people, even though it's not the most accurate way, but is like a physical culmination of anxiety, or a way that you show up in the world because of a layer that is one of the layers is anxiety, and that's the way I describe it to people, because I don't think people understand beyond that point.
Because they often say, oh, when you tell them your traits as someone who's autistic or ADHD or something, they're like, oh, well, everybody has that.
Yeah.
I'm like, no, there's distinct differences.
Yeah.
And can you kind of go off of that a little bit more as the expert?
Yeah.
Of like,
Yeah, I will say that like across all different kinds of presentations, there's like a hint of truth to the idea that like everyone experiences, but the way that we communicate through diagnostic criteria is also considering that like, how does this impact your life or your functioning, whether that's your mood, your social life, your self-concept, your ability to like move around the world and do things. So it would be like saying to a person who has like severe depression, like everyone gets sad Sure.
Yeah.
Yeah.
So
Most
can be
people
so
experience
patronizing.
sadness at some point, but it's not the same. So with ADHD, like, there's no one in the world who 100% has perfect executive functioning and focuses all the time with no distractions. So yes, everyone experiences distraction, but it's not the same as it interfering with your life and you having to compensate and learn other skills to deal with those kind of things.
Yeah.
I think it is because people have had more access to the language and there's a little bit less stigma now. It's a good thing on one hand because people are developing an understanding of themselves and finding community or finding care if they find therapy helpful. But also, you do have some people who have a little bit of anxiety around the idea of the diagnosis. So if they're like finding themselves not able to focus, they automatically think like, oh, I must have ADHD. And it can turn out that like,
yes, it's
you're
a
just in
word
a
thrown around a
stressful-
lot.
It's finals.
Yeah, it's finals
Yeah.
and you're stressed. Exactly. Like that is so I think that's the reason I think that I've described it to people as, you know, it's hard to describe something as severe when it just comes across to other people as quirky, right? So like
Yeah.
like that's that's one of those things where you just want to like you want to find different ways to explain it to them, but at the end of the day, when you over explain your autism to someone, you're just kind of like, not everyone really understands or wants to at least listen to that. What do you so okay, Haley, you're gonna say something about that, or you said no, you weren't gonna? So I'm just passing
just
the
a
buck
little
to you.
bit. No, I know also nowadays too, a lot of comedians, when they're talking about themselves being autistic, which it is funny to an extent, yeah, but also they're describing it as, oh yeah, let me pick up some rocks. I like these rocks. And like it's making it very that one girl in school who was really what like what do they call it? What was the term that they used for that girl who was quirky in school?
A Tumblr girl, or
something like that. And then later on they're like, oh, she was just autistic.
no, she just like dinosaurs. Like a girl that likes dinosaurs. No, I think that like that's So I actually went to a comedy show last night right down the way. It's called Don't Tell Comedy. They do it all around the country. And a comedian came up, and one of his jokes was that he had an autism joke, which I thought was funny, but then he started describing it as non-emotional. Like, so he described a few things that were like basically like kind of some of the trappings of like what people have general knowledge about.
Yeah.
If you were to dispel any major myths about autism in general or any other disorders, what would they be? Well, let's focus in on autism. What would they be if you were to distill from your personal experience with your clients, patients? What are the biggest things people get wrong?
Mm-hmm.
Yeah. That's a great question. And as you're asking that, I'm thinking of some of the things that people who I've seen in therapy on the spectrum have said themselves. I think similar to your point about the mix up with anxiety, a lot of people mix up like social anxiety with features of autism.
Mm-hmm.
And some people on the spectrum have told me that like it's not like they don't want friends or that they're wanting to be socially isolated or not like engaged with it, which I think is a stereotype that a lot of people believe. And to some extent, yeah, there may be some people who, because of other characteristics, do want more alone time or isolation. But there are a lot of people on the spectrum who want to have connections. Or the idea that like there's a complete lack of social skills. I think a lot of the time people on the spectrum are trying to manage the cost of like being authentic and maybe socializing in a different way versus needing to do a performance to maintain relationships and friendships. And thinking a lot about like what is the script, or what would be the quote unquote normal thing to say or normal way to act.
Sometimes I definitely, and Terrence has said this too, we feel like we don't have the script. And every time I'm at work, I'm like, am I missing something? Because I'm always hyper analyzing how someone's reacting to me. And I'm like, am I not smiling enough? Maybe I need to animate myself more. I'm just relaxing right now, and they're relaxing too. But then do they not want me to relax? Or and then it does feel like social anxiety at that point.
I think at that point it's kind of a compensation issue, right?
Yeah.
Using all your cognitive ability to make sure you're not messing up, and I do think that, and then that will fuel extra anxiety on top of it. So I think of it as a cyclical thing. Like, it's just like it goes in a circle. You start with some underlying anxiety in the situation. Then you go to the actual interaction itself, and then it cycles back, and I think that it's, I came out of my shell a lot more like socially over the years, but I had to really intensely like observe society. I had to take a deep, hard look at civilization.
The difference with you, Jackson, I noticed, is you went up because you were diagnosed when you were young. So you went up. I have a identical twin sister. Our skills went downhill. We regressed. And do you know, can you explain regression? Because it doesn't fully make sense to me, because I'm like, how can I seem more normal when I was younger, and now suddenly right now I'm fine, but like sometimes I can't figure out how to do things I used to be able to do. I hit 30.
You feel like you regressed?
Yeah.
I don't see, that's a personal, that's like,
okay, thanks, Jackson.
I don't think you regressed.
All right, whatever. No, I actually did. Yeah.
Okay. Well, I do think so. That's very, real. So have you seen that in patients where what do you see the difference of a later diagnosis on the personal perception around spectrum disorders or versus an early diagnosis?
Yeah. I think one of the most important things, and part of what contributes to people when they get their diagnosis, and then the I guess like the timeline of how that unfolds, is the family environment. So someone who was, and like socioeconomic conditions too. So someone who was diagnosed really early had access to those resources because the evaluation and testing is very expensive. I believe, depending on your insurance, it's covered for younger children, but at some point is not covered anymore. So access to those resources, but also attentive parents who were there to observe and care enough to take them to be evaluated. I often see that people who never got a diagnosis or got their diagnosis really late are sometimes people who come from families who were either not very supportive in general or actively like stigmatized whatever behaviors that they were seeing or that they didn't understand, or even like punished those behaviors. So I've had people say, yeah, my parents thought I was just a bad kid and throwing tantrums, when it was them trying to figure out how to like self-regulate or self-soothe or something. So some people come to find or even consider a diagnosis or reaching out when they're away from a toxic family environment and can come to treatment or evaluation on their own later as an adult. To your point about the regression, I think that's also I can't say in total, but I would imagine that environment has a lot to do with that as well, in terms of how much structure and support are helpful as a child. A lot of people are getting like behavioral therapies and different accommodations in school. And then when they are in environments that are more stressful or high demands or don't have as much structure or support, then some of the skills you may have been practicing and had an environment to reinforce are not there in the same way to support you, you know?
Okay.
Yeah, that's the thing you said about specifically, you know, this is something we brought up a few times on the podcast about importance of like parental units, and it kind of like do they have enough time and resources to take action first and foremost? Like, do they live near a major city? Do they, you know, like that was one of the big things back in like the early, when I was diagnosed as like 2000 or something. Like, could we get to San Francisco to go to University of San Francisco to go to find a specialist to get a diagnosis, right? So you have to actually have some sort of like general resources, and then on top of that, a general investment in your kid's life and whatnot. So
and especially in my case, my parents were very, very like, they did a lot for us, and we were pretty well off. They brought us places. They just didn't know what autism was supposed, like, it wasn't as well known for what it was supposed to look like versus what we know about it now. So to them, they just thought for a lot of it, we were just misbehaving in certain ways, you know? And when they took us to see therapists and psychologists, they didn't call it out. So our parents were just like, I guess it's just anxiety. So yeah, that's in our specific circumstance and everything. So they did, in our case, they did try to help us. And now that they know, like, they're like, oh, things make a lot more sense with you guys.
Haley and I discussed your specialty when it came to this, and not only just the main focus on spectrum disorders, autism, you know, all the chisms, but also the concepts around first generation households and, you know, diagnosis when it comes to that. What is your big, like, top of the list takeaway that you've learned from your studies in that when it comes to kids in those families?
Yeah, I think that what I would say, and I remind myself all the time and to other professionals, is that, like, so I work with a lot of children of immigrants as adults, but also immigrant families with children, knowing that, like, they're going to be the experts on their experience in terms of being able to say where they're coming from and describe what their child's behaviors are like. And they may not have the same exact language. They may not present it in the, like, jargon clinical way that you may understand things coming from a Western lens or as a clinician, but having that attitude of cultural humility that, like, the people I'm sitting with know themselves and they're trusting me enough to share, and taking that in, also offering what's coming from your expertise and collaborating together so that you are offering them the help that they need, but developing an understanding that makes sense for everyone involved. I think sometimes clinicians can give information, like diagnostic information and things to the families that they're treating in a very kind of like cold and distant and not culturally informed way. And then so that leaves the family even more lost with how to access resources or what are the next steps, if there need to be any next steps. So I would say that's my big thing, just having that stance of knowing this family knows their child, they've observed the child every day for their most of their life, and communicating in a way that both of you are on the same page and understanding.
Yeah, so it's a big cultural, difference when it comes to how the information is received. Do you think it's also potentially sensitive so just from a stigmatized perspective, just a viewpoint on mental health in general from different cultures can be very different from maybe the point we're even at now in the Western world when it comes to like, at least my generation, millennials and younger, perception of mental health issues or diagnoses. Terrence, maybe you can allude to this. This is an experience you have from you have a Haitian, mom and
Haitian. Sir, I'm Jamaican. Where are we going with this? Oh my god.
No, I'm claiming it's Haitian.
It's like comparing Crips and the Bloods.
It's like saying a Russian. It's like saying a Russian is Ukrainian.
Exactly. Like, you don't want to do that. The war's been going on for God knows how long, and there's still no resolution.
We can blooper this. So anyway.
Okay. So I came from two Jamaican immigrant parents. Basically, most of them kind of live over here at this point. That's a lie. They're all over the place. But anywho, I was basically the quote unquote problem child. So I was that kid who would like be a bit of a menace. For example, my very first day of kindergarten of first grade, bit my teacher on the leg and left a mark.
Oh
yeah, I don't understand. What possessed me to do it, but it happened. Especially in kindergarten, that's where a lot of the chaos started for my mom. I would kind of just say things that I probably shouldn't have. And when one of my teachers tried explaining to her, oh, I think he might be either autistic or somewhere on the spectrum, they wanted to put me on some kind of medicine. I want to assume it was downers because I was all over the place, and my mom did not want them to do it like at all. It was a huge staple in Jamaica, where they don't take mental health all that serious. They take like depression real seriously. I know that much, but when it comes to like anxiety or ADHD or autism or anything like that, it's pretty much thrown under the rug. My family's now starting to get it. My mom especially, but that's only because I started to learn more and more about it. Other thing that would happen while in kindergarten, one morning I was getting on my mom's nerves, and she said that she would throw me into the closet and go to work, and I thought there was a monster in there. And then I went to school, was drawing one day, and then the teacher goes, Terrence, what's that? I was like, it's the monster that's going to get me when my mom locks me in the closet and goes to work.
Wait, so tying this in, so like, this is like, is this an experience that maybe you've seen, that's relatable to that experience, or I've heard these stories a lot from like immigrant families, from like first generation families. What is the best way to handle situations like that where you're on the precipice of maybe getting treatment for a kid?
Yeah, I think aligning with or illuminating and then aligning with the parent on shared goals. So the parent may not be ready to absorb all of the information of an ADHD or autism or other developmental diagnosis and what all that means. But maybe they do want strategies to help their kid regulate. So as you're communicating that to them and like formulating if you're doing a specific treatment plan or intervention, coming alongside them with what their goals are. So maybe it's like he yells a lot and throws tantrums. Let's get a hold of that. Let's like figure out what that's about and reduce that. So they're seeing a change that they maybe want to see. You may have more information about the underlying factors contributing to that behavior and all of the like clinical knowledge that they may not be ready to digest and accept and embrace. But you can come together on starting with where they are and working on some specific goals that will end up benefiting the child in the short term and in the long run. So maybe you are teaching them specific parenting skills and behavioral strategies that they then see are helpful for them to regulate themselves as a parent, to better respond to their child. And then maybe they'll be more willing down the line to be curious about and understand the source of some behaviors, and also accept that, like, if this is an autism spectrum thing, it may not be that the end goal is your child being like every other child. They're going to have specific needs that they may need to be attended to in a different way, and that may require different things of you as a parent. But I think any parent that really loves and cares about their child will have, or the parents that I've worked with are eventually open to, all right, I see that this clinician can help me with this goal the way I understand it now, you know?
And how many of the so that's really interesting. I was going to say most of the time, let's just say the cutoff is the point of medication, meaning that like that they're willing to do anything except medicate their child, right? Because a lot of people are, might be against it. What do you is that something where you like, I can't work with them anymore because it's like, if it's severe enough, we might need to do that? Or what is how do you handle a situation where they want to go the holistic route, or they want to go a certain direction, like what Terrence was talking about there?
Yeah, and I think the best course of like maintaining a good therapeutic relationship is to fully hear and accept their needs and desires. So as a psychologist, I don't personally prescribe medication, but I'm on the more cautious side of when I do recommend someone to see a psychiatrist, for example. I think that I'll often present like different offerings. So yes, we can try all of the different holistic or behavioral or therapeutic things, and let's set a like realistic goals or a timeline to see what are the changes or differences that you want to see. What is the expectation about the timeline? How much of a difference are you hoping to see? And unless there's no immediate threat in terms of safety that requires a higher level of intervention, then let's do all those things, see the progress we make, and then reconsider if medication makes sense. I would say, too, that even when people see a psychiatrist, a good and ethical psychiatrist is also not necessarily going to like enforce or force anyone to take medication. Your initial intake with a psychiatrist can also just be a consultation to ask questions. They'll get to know some of your history, and they should create a plan too to start with a medication and dosage that makes sense, and have an environment where you can communicate with them about any side effects or changes or things that need to be made. So I think you can present it as another tool or option that could be helpful, but that even if someone does take medication, it's most effective when it's something that they see as useful to them, because that means that they'll actually take it as it's prescribed, or they will be adherent and take it consistently.
Yeah, and I think
as opposed to like a more negative attitude.
It could be, and it's so I had severe Tourette's when I was younger too. So I was also diagnosed with it on the spectrum, but I had severe tics too. So that was like the thing that overshadowed everything else was my Tourette's, right? And that had to be medicated because I couldn't socialize if I was mosh pitting around in my seat. If I couldn't, function. There's a lot of concerns. You couldn't drive, or there's a lot of things that I wasn't sure I was going to be able to do, let alone run a business, but also drive a car. So there's a lot of questions that arose as a child for stuff like that. And I'm off medication nowadays. I luckily had the type of Tourette's that did fade away with my kind of body chemistry changing. But I would just want to say, just from an overarching perspective, we talk a lot about autism in media. We talk a lot about things related to the conversations around it. The psychology world, because I know other clinical psychologists. I actually doing a tech platform, I have a tech contract for that ends up facing with people from UCSF, from their whole department there. It's a super niche world with super niche acronyms, with super specific forms and lists and everything, right? But when it comes to the public conversation around this topic, it's hard to break through a lot of the time, because you get, what would be the main thing that you would like to say that should be more part of the general conversation around autism that might be more unique from your perspective?
Yeah, as you were talking, I was thinking about your question on misperceptions, and I think that to the general public, I think there's still this idea that it's something that needs to present in an extreme way, that either someone's on one end completely nonverbal, doesn't make any eye contact or socialize, or on another end, or in a different place in the spectrum is like savant kind of stereotype.
Mm-hmm. Rain Man.
Yeah. I think representations in the media now seem a little bit more nuanced, but I have also seen people on the spectrum say that the shows that are out there, like the Love on the Spectrum show, but more like the fictional characters, not so much reality, that the fictional characters still don't feel like it's a broad enough representation of how much nuance and individuality there is with people on the spectrum. I don't know if that answers your question, but
yeah, I think that's a good assessment.
There can be a lot more clarity in terms of the public facing image of what autism spectrum looks like.
Mm-hmm.
We have a lot of we're potential to get some guests that are actually featured on Love on the Spectrum. We're in contact with some people, and we do think that my personal take on it is I do need to watch more of it, but I think this kind of ties into Tourette's. When I watch other people with something that I have, it actually flares up all the feelings that are related to it. It's like when you're watching someone with Tourette's, you start having adopting their tics. It's a strange feature of that stuff. I don't watch it because of that, a little bit of that, but I also think that sometimes it might infantilize the situations where it makes it look kind of cute. And the way that I try to and it's not a bad thing. They're really featuring some cool people on there, but it's the music choices. It's my production mindset that's going into that. What so for my question to you is, completely lost my train of thought. I was love on the spectrum. The reason that I brought that up, you brought it up, was oh my god.
You can do it, Jackson.
No. The more we talk about if I can do it, I'll completely lose what I was saying. So infantilization. Yeah. So I think that, like, I understand what it was like growing up with it, to feel the kind of internal, like, pain and suffering part of it, which I don't think that is actually described a lot. I think that it's the locked in emotions. That is what it feels as though, like, a person trapped in a person type of feeling that you have is an intense feeling of struggle and suffering, and I don't think that's really noticed or addressed a lot of the time. That's why the depression or things that can kind of come out of those intense feelings, and a lot of people, because of the way they interact, will be like, oh, they just don't have the same they don't have the same emotion. It's like, no, they're like, sometimes it just feels trapped. Like, how do you describe that to people that, like, don't understand, like, this is something that is be a lot of struggle, and, like, it's not all cute, you know? How would you do you have any, like, reflections on that type of side of it? Like, because it is you do see every side of it, being, you know, yourself going to see these patients, you see, like, the kind of beauty of it, and you see the struggles that people go through. What is your perspective on that?
Yeah, I think the average person has a really difficult time doing what we call, like, mentalizing. So, like, imagining the mind of another person, spectrum or not, just like one person imagining what it's like to be experiencing the mind of another person. So for people who are neurotypical and don't have many barriers to feeling like they can fully feel and understand and express emotions in a socially acceptable way, it's hard for them to imagine not having that capacity if they've always had it or always been reinforced socially that they're doing things the correct way. So yeah, I sometimes some of the people on the spectrum that I work with will express, like, I'm feeling this feeling, but I don't know if this is the way that this is supposed to feel. Like, is this how other people feel, feeling this feeling? And we'll talk through, like, let's focus on what you're experiencing now so we can understand what that's like for you, whether that's, maybe we'll figure out the name of the feeling later, but, like, for example, how does your body feel? And being able to say, like, I feel tense, or I feel hot, or I feel jittery, or what thoughts are associated with the feeling you're feeling. Or I've worked with people who feel like some guilt and shame for having an intense feeling, or worrying about how people will perceive them having the feeling or expressing the feeling. So it is definitely a different experience that the typical person has a hard time understanding.
Yeah, and I definitely do feel that a lot, for sure. Yeah.
Guilt and shame. I'm just trying. It's the way that I said it that made her laugh. The guilt and shame of it all.
Guilt and shame of everything.
A drama student.
No, but every single job I've ever had too. If we're going into that, like, just
it's good. He's good.
It's fine. Yeah. Oh, okay.
No, I'm just giving him looks. I'm directing with my eyes, which is not good to do with people on spec. They won't. I'm giving him looks every now and then. Like,
I feel like people. Okay, now you're distracting me. Now I'm going. No. Wait.
Okay.
What was I talking about?
You were talking about. We went from guilt and shame to feelings about. You're starting to describe something. You were getting towards describing something that you were about to talk about. If that helps.
Well, it's
very
okay.
helpful.
Let's move on because I lost it.
We are running close to
okay.
the end of time.
Yeah.
So I actually do want to focus in on Haley in conversation because I need to go let one of our crew members in. So
Okay.
just Haley, ask you a question. I'm gonna come back in quietly and then rejoin you to finish it off. Okay.
Okay.
So don't cut to an empty chair, parents, if you can help it. I'll be right.
Cut to the empty chair. There we go. All right. Thank you, Jackson. Okay, so I guess we'll go back off of what were you describing before this?
We are talking about the feeling of I think he had described it as like the emotions feeling trapped.
Oh,
and how other people understand that experience or not.
Yeah, I know when I was younger and my twin explains this too, is I always felt like we were doing everything wrong, but then being told we were doing it right, but then people weren't responding the way they were responding to other people, and we had trouble keeping friends, and we thought that friends were supposed to be like not surface level, but then everyone just wanted surface level. And so we didn't really fully grasp the concept of friendship, honestly, most of our lives. And so we definitely felt that guilt and shame of like, oh, there's something we're like we're trapped in ourselves. And then as we grew older, we got closer and closer because we felt we truly understood what was happening. And in our adult life, I still feel like we don't have the full script of what's happening at all. So yeah, I understand like to what Jackson was describing in that. And then he's coming back too. So I was talking about. Hi. Sorry, we have a person coming in to assist.
We need it.
Mm-hmm. Yeah, but we were talking about Sarah and I and friendship when we were growing up. But
about friendships, about keeping friends.
Yeah. Mm-hmm.
I think it's one of those. I have some weird anomalies about mine of it. I didn't have a problem keeping friends, but you know, over the years, they did kind of end up to be slightly more ADHD. They also had traits that were not too far off from mine, like just some standard ADHD and just. I do think that you just attract people into your life that are just a little bit more outcasts. Like, yeah. And I don't have the atypical friend group. I don't have the bros that watch the NFL game every Sunday. I don't have like a lot super basic friends. A lot of them are artists.
I don't have a lot of friends who are women. Most of my friends are guys because I always felt like I wasn't really good at being friends to women. I didn't really understand, and guys a lot of times felt simpler. Like they didn't judge me for my reactions to things as much. I don't know.
I judge you all the time. Wait, no, I was going to say.
Differently, not in the same way. Her place sometimes being like, yes, and this is the factual basis of this and this and this, which we have a clinical psychologist.
Yeah,
right
I know you can roast me, but like, no, I'm giving her like an example of something that I experienced.
Yeah, yes,
then, like,
I'm just
joking with you. Yeah, I know. I'm an armchair expert.
I will say though that speaking of like childhood and peer pressure and things, especially in your adolescence for everyone, but I imagine it being even more stressful for someone with neurodivergence or other things that make them different. In adolescence, you're moving away from the phase where your parents and family are the most valuable opinion to you, to like extreme pressure to fit into different social groups, or to be not just the norm, but to like do certain things that are going to be reinforced to make you like popular or well liked. I think that happens across all gender, but there is something about like how we study different types of relational aggression, and women and teen girls tend to be more on the side of not necessarily overt, explicit physical aggression, but some of the things that maybe Haley you're pointing to, the relational aggression of like, we're gonna, be mean girls kind of thing.
Oh yeah, no, that makes total sense. Yeah, just the non-physical, just the complete mental mind games or aggression.
Yeah,
right?
And then I don't understand girl talk. I still don't understand girl talk.
Yeah, that's.
I'm like, oh, we're gonna, yeah, of course, and I just kind of feel like I'm part of a performance or
like
something.
you're on the wall, like you're the tree in the background of the school play.
Like, we should just talk about really deep things all the time. Isn't that what we're supposed?
Yeah, I think it's just more maybe a sign of also just you crave intellectual stimulation, because like at the end of the day, if you are a deep thinker, you don't want to hear about the fourth like breakup story from the same girl. You don't want to hear the same thing over and over again. I do.
Yeah, but I also still do crave it. Like, I feel very honored when I'm joined, like when someone invites me into girl talk, and like that just recently happened to me, and I was like, I'm doing something that other people, I guess other women do, and I'm part of it, but then I still don't understand.
Oh yeah. No, but I feel great when I'm a part. Like I was at a pool party where there's a lot of like, they're music producers, and like LA parties are the place where you could really test if you're on the spectrum. Like a Beverly Hills party. Think of me,
true.
You're either going to be for me, I'm very social. I am very social. I go out there and I do meet people, but you're either going to be, in my case, like a social assassin in conversation, or you're going to be
it's a hit or a miss for me.
or people are going to really like the fact that you like to talk about these things, or you're going to inspire people in some way to get out of their shell. So I hope to say, like, from my perspective, you're inspiring people to get out of their shell, and then you also are trying to, in some way, shape, or form, understand where to add the punctuation to your sentence, right? So like that's a masking part. There's a part where you're just like full on expression and like creativity in conversation, and then there's a part where my brain has to go.
My face
out
hurts.
Of period.
Sometimes I'm so hyper aware of what my face is doing that sometimes I feel like my brow is going, like, is spazzing or something, or that my eyes are too closed. Or
yeah, he's like, start to self-edit or something. Yeah, no, I understand. So that's a great, parties are a great litmus test for that. And especially in LA where everyone will judge you. You just have to go, you just have to dive in. And I think at the end of the day, I think living with this thing a long enough time, I just stopped caring once you just let go of what anyone else thinks.
My 30-something odd years in this life. No.
just the practice of figuring out how to let go. I'm also an advocate of meditation for people with autism, like things that actually could uplift the spirits of people with. And ways to cope, or we
can close out with that. With you sharing any insight or anything you would like to say about what could help people, who are listening to the podcast.
Yeah, I think to your point about being yourself, there are some things where, like, if it really is going to impair your functioning, like you mentioned with Tourette's, like not being able to drive because of some of the motor issues and things like that, then sure, some interventions make sense. But I think, like, there is a lot to be said about if it feels worth it. Some people want to, like, go full blown into, like, social skills training. I want to be able to mask as much as possible and appear quote unquote normal around things that are not necessarily impairments or detrimental outside of, like, the social judgment of other people. And then there are some people who are wanting to work on what is it like for me to be my authentic self and whatever that means, wherever they are on the spectrum, to not have to perform or mask all the time, or to find that community of friends who are going to be understanding and patient and willing to hear the different things that they have particular responses to.
I definitely know people nowadays are used to are more becoming more used to, oh, you're autistic, but when you show your autistic traits, then it's not okay. It's okay that you're autistic, but when they see you're autistic, it's like, oh,
because I think there's a lot more patient people out there. I think that maybe that like it might not be it just might be that they're surprised about how it appears to be.
Yeah,
they might not be like judging you. They just might needing to readjust, right? So like, I think in any friend group, if they're discovering what that means, it is like, you know, it is what it is, right? I think that getting people who say, yeah, I don't care either way, like whatever you have, man, like that's actually good. I actually would prefer if someone says, I don't care either way, and then they just having you around, you know, going off a vibes perspective, right? You just want to have, you know, someone that says, I don't always want someone who's overly invested in the fact that I have something. And even me, I don't actually want to be over invested in the fact that I have it. And that's where my mentality is like, it's not necessarily masking. I just don't think everyone needs to know.
Yeah.
And like, that's where over the years I started to change my perspective on. It's not that I'm ashamed of it. I just need to not feel like it's a thing that's have to impose on people. And I feel like I can blend in enough with my level of that to do so.
And it's okay if you don't blend in, though.
It's okay if I don't blend in, because I already have personality traits that don't already. Like my creativity also doesn't blend in. My, you know, stuff that I do in my work and art doesn't necessarily blend in. So like everything matches that aesthetic anyway. So I guess the point I'm trying to piggyback off of what you were saying there is the friend group is really important, and but I also think that it's like, yeah, I also don't want to feel like I'm being that people are being overly cautious for me.
Sometimes I definitely feel like if I end up mentioning, hey, I'm this, but if something happens where I have to say something so that they understand more, in certain situations, they are over cautious with it. Like they're more like, I don't know, overcompensating for my I feel like it's okay, you can still treat me like you treated me before.
No, I mean, listen, I've had fantasies about pulling out the autism card at the right moment. Like
at the right moment. Like, I have a card right here.
Just like, it's not it's a fantasy that makes someone that was treating me horribly to be like, ooh, red card, you know, like I got, you know, the
last time I did that though, they said I was too much, and then online said something like, you sound like you're on the spectrum, like it was supposed to be offensive.
Oh yeah. Well, that's the thing, is that like we just don't like interact with that type of energy anyway.
Yeah.
I do think you're still gonna have people and bullies and people out there that see it as like a crutch. So I really could care less about what they think. I just do know that there is a certain level of isolation that a lot of people can feel because of those reasons, right? Because they see a world that is ready to like make a complete joke out of it. Yeah, hold for siren. Hold for it's the summer. Maybe there's another, you know.
But like, you're gonna have those experiences. Not everyone is gonna be understanding, and not everyone is going to be going to have a good heart about it. Not everyone, like there's different personalities, and again, also it's not like they're required to stick around for you either.
No, it could be a passing thing.
Yeah, exactly. And so I guess moving forward from feeling certain ways in relationships, we just have to go with the flow understands that you can't control other people, but then that doesn't make it okay for them to treat you certain ways.
Yeah, you can still have I think I'm proof that you can still have a backbone and have autism. You can still be able to be ready to have the tools to confront people and stand
going
up
back
for
to all
yourself.
those stigmas about autism, right? People who are autistic aren't necessarily you're not devoid of emotions. You actually sometimes have too much emotion.
Yeah.
You're not unable to fully read people. You just sometimes you read like micro expressions, like, and then there are different. Like, if you meet an autistic person, that's one autistic person. Everyone's different. Like, it doesn't magically mean that you know what autism is.
Yeah,
so,
and I think that, we live in the WebMD world. We would live in a wiki kind of world.
Yeah, like, let's look it up.
No, I think that, like, it's like, hey, ChatGPT, like, tell me about, this one thing about autism. No, I think that I honestly think the stigma in relation to it is getting, like, things are getting better. And there's more conversations had about it online. Your discourse is Gen Z and Gen Alpha. So our podcast is, I feel like, going to, hit the market with a lot more people like that. What would you say, this is, I think, a good final question.
Yeah, final question.
This ties it into your, like, whole area of expertise. This is like, the thing was, like, self-diagnosis through, like, means of, like, social media and TikTok and, like, no personal relationship to it. Give us there's an understanding that's, empathetic to the fact that if you self-diagnose, it's just because you don't have the resources to go and get and seek help. And this ties into access to healthcare, to psychiatric, needs. What is your take on self-diagnosis, and then what is the solution that you would say to someone who's like, I don't really know where to start, what to do, like, what am I even doing?
Yeah.
So what's your advice to them?
Where am I?
Where am I?
So I'll start by saying that I think most people who end up kind of, like, doing their own review of the literature online or review of different experiences and have a formulation about themselves or a self-diagnosis are probably coming from it with, like, a genuine curiosity or sometimes with distress in trying to understand what their experience means, trying to, like, have a name for it. And a lot of people, testing is so expensive because, like, the different questionnaires and testing materials themselves are expensive.
Like $9,000.
And then in doing the testing or the evaluation, you're not just, like, it's not just the cost of that session or a few sessions, but the time that it takes the psychologist or psychiatrist to score and evaluate and interpret all of the measures and then differential diagnosis and rule out other things. So there's a lot more that goes into the more standardized evaluation and assessment process that makes it so that there are cost barriers and time barriers too, and a bunch of different access barriers that not everyone has thousands of dollars to go and see a professional and all those things. So definitely people who are self-diagnosing are probably coming from a genuine place of curiosity. I would say, though, like, have an idea or try to develop an idea of what is this diagnosis going to mean to you. So people have different attitudes toward diagnoses. For some people, it's, okay, this is a new framework that I can have language for to understand myself. For some people, it's, all right, this is going to help be the tool to get me in community with other people who have this same experience. For some people, it may need to be the more formal route because they do want particular accommodations for school or work or access to medications or different things. I would say that if you're someone who doesn't have access and you're thinking through and self-diagnosing in your head, that like focus on the goal of understanding what your experience is, and not necessarily what it will mean to have the label per se. Because you're still you. You've been you the whole time, and you've been having these experiences internally or behaviors or social interactions. And if that helps you get a better understanding, then sure.
I know it changed my life.
But it could be helpful to clarify with a professional whether there are other explanations. So, for example, someone may have difficulty with focus and attention, but it's specifically when it's like verbal. So they may have like an auditory processing thing and not ADHD. Or someone else may have like a specific reading learning disability and not, and so it's the help of a professional to do those like differentials can be valuable, but definitely understand people wanting to know and understand their experience and have language for it.
Yeah, no, that's an incredible
Thank you.
answer. Yeah, thank you so much.
I got a little emotional listening.
Oh, I noticed. I saw the tear ducts going.
Whatever. I think that's cry.
No, you're allowed. You're allowed. No, I think the things you said about people's reasoning and the that you're basically still the same person after I think it's going to be really helpful for people to hear, because that's like it's very true. It's it's you don't change because of your diagnosis. You unlock some potential for treatment or otherwise, but definitely. I think that could unlock a lot of like people's distress around receiving a diagnosis. So
yeah, definitely on my end and Terrence's end, we simply not just being on the spectrum, nothing like that, but simply starting to be able to understand how we work, we unlock so much more potential in ourselves. Yeah.
And I have to work with these
Terrence,
two, so.
Right?
And I have to work with these two, so I know the whole.
I know. Thank you.
I had to take something sincere and turn it around.
Definitely, completely and utterly changed my life.
Yeah, no, and it did, and I think
every single part of it.
It unlocked something for you. It unlocked your ability to really understand yourself in new ways. So I think it's pretty awesome. Well, Mercedes, it was so wonderful to have you. Is there anything else you want to talk about or plug before we sign off?
Plug your services or anything.
Yeah. So if any of your listeners are in New York, they can find me in private practice. You can search my name, Mercedes Okosi, or look up Growth Work Psychology. I'm on all of the Psychology Today and my website and everything. I have a couple of books that are available. So I have a journal for complex PTSD you can find on Amazon. I'll send you all the links to these things so you can share. I have another journal that's specific to Black women's mental health. Mm-hmm. And I have speaking of boundaries, a book coming up soon for people who struggle with boundaries. There's some anecdotes and then skills and resources to communicate assertively and work on boundaries.
Wow.
So
awesome.
Yeah.
Nice.
I'm thankful for you all having me.
We're very happy to have you. We're so glad to have you as well. It was a very wonderful conversation.
Yeah.
And we feel free to check in with us anytime. You're now a friend of the podcast, so we might
friend of the pod.
You are a friend of the pod now. You're gonna make it to the wall. Maybe we'll put you up on the wall.
Put on the wall. We have a bunch of photos.
So well, thank you so much, and we'll wrap it up. But it was so nice to see you here.
Thank you, Dr. Mercedes Okosi. You are amazing, and we will hope to speak to you soon. See you soon. And bye.
Bye. It was nice to see you. Hey, y'all, thank you so much for joining the Neurofucked podcast. We'd love you to hit subscribe, like, comment, find us on your favorite podcasting network. And we just love that you're here to share this experience with us.
Thank you so much for joining us and for listening in. We appreciate all of you guys. Please stay, join us for the next coming episodes, join us for the future of whatever this podcast may hold.
You are the future, and we'll be there. We'll be your future, and we'll love you to the end of time. Not in that way, but like in a very friendly, kind, loving way.
My smile really actually hurts right now. It started shaking in the corner.
We need to end this all. Let's go. Okay, bye.